Welcome to Rainbow Kitty's channel for parents. Nurture emotionally healthy children with us.
Now let us explore the treatment options available for OCD. When to see a doctor. There is a difference between being a perfectionist, who is someone who requires flawless results or performance, and having OCD. If your obsessions and compulsions are affecting your quality of life, see your doctor or mental health professional. People of all ages with OCD understand the senseless nature of their obsessions and compulsions. This may lead to shame, reluctance to seek help, and incorrect diagnosis by health professionals. People with the disorder have long delays in accessing effective treatments. This could be even as long as 17 years on average as per a study. They are frequently taken to non-psychiatrists for treatment of skin issues or other illness, and the underlying psychiatric symptoms go undetected. Ensure that your child gets help quickly so they will not carry this condition into their adulthood. OCD diagnosis. Quick screening for OCD includes questions like, do you wash or clean a lot? Do you check things a lot? Does something constantly bother you? Do you want to get rid of it, but cannot? Do you take a long time to finish your daily activities? Are you concerned about orderliness or symmetry, repetitions, numbers? Do these problems trouble you, and how much? Your child's doctor may do a physical examination and blood tests to make sure that their issues are not being caused by something else. They will also discuss their feelings, thoughts, habits, etc. Doctors look for specific criteria when diagnosing OCD, including the presence of obsessions, compulsions, or both, that are time-consuming or cause significant distress or disrupt social or other settings. Doctors might also look for OCD symptoms that do not result from the use of a substance or medication, or that cannot be better explained by another health issue. Once the diagnosis has been made, the use of standardized instruments may help to define the profile and severity of OCD. These instruments might also be used to monitor response to treatment. OCD treatment and support. There is no complete cure for OCD, but you may be able to manage how the symptoms affect your child's life through medicine, therapy, or a combination of treatments. There are several therapies and medical procedures that therapists, psychologists, or psychiatrists might use to help children who have OCD. I am mentioning only the ones which parents and caretakers can use to support such children at home in addition to professional support. Behavioral therapy. It involves exposure and response prevention or ERP, and cognitive behavioral therapy or CBT. The child is exposed to situations and objects that trigger fear or anxiety in them. Repeated exposure leads to a decrease in anxiety over time. This is called habituation. Family or caregivers can be enlisted to help with exposure practice at home. Response teaches the child to resist compulsive behaviors. CBT starts by encouraging the child to identify and reevaluate their beliefs about the consequences of indulging or not indulging in compulsive behavior. The therapist may help develop a less threatening alternate response to the obsession. Relaxation and self-care. Therapists can also offer guidance with coping strategies. These could be breathing exercises, yoga, meditation, or other mindfulness techniques. It could also include creating a self-care routine, talking to loved ones, etc. Though it might feel difficult to talk about OCD with loved ones, isolating oneself only makes matters worse. Reaching out to family, friends, and loved ones can make it easier for the child to get emotional or any other kind of support. Family members should be educated regarding helpful ways to support the child. These include cutting down on expressing negative emotions, refraining from giving reassurance to the child, etc. Joining an OCD support group can be another great way to connect with other children who understand what they are experiencing. Some children with OCD fail to respond adequately to either cognitive behavior therapy, drugs, or a combination of the two. For such cases, Careful reassessment to detect and treat related problems may improve outcomes. For example, children with developmental difficulties on the autism spectrum may be susceptible to OCD as teenagers. These patients might need specially tailored cognitive behavior therapy. Watch Part 1 to know more about signs and symptoms of OCD, Part 2 to understand the possible causes and risk factors, and watch the last part to know about the related conditions and support available for OCD. Links are in the description.
Like, share with your fellow parents and subscribe to get notified.